Mr. Bogarding.
Yeah, thank you. Just following up what Dr. Weber here had. So clearly the bill doesn't say that by implementing this, CalCare would not be able to go forward. They're just saying the impact if this passed. So that I don't think that's quite accurate as you allude to. But the big picture here is that I asked to be on this committee for the speaker 6 years ago because the price of healthcare is just ridiculous. Too many people get left behind. It's the number one reason why people file for bankruptcy. It's the reason why school districts and cities are fighting with their employees to pay living wage and salaries. Healthcare costs many times. Small businesses can't pay the increasing premium. So doing nothing this will all fall apart. It's a house of cards if you look at the ever increasing costs of premiums. And so I supported the single payer first bill, like you did. I think it was Senator Lara's that first bill. And then we've had a second bill by Assemblymember Collier, which I was a joint author like you as well. And there's a third one, which I'm an author now, the third time, and you right now are waiting to see it fully in print. So this is a bit complicated, and I'm torn because, we had a colleague, one of our friends here, Lorena Gonzalez, she had this sign at her wall, which her and I believe in this, is the most amount of good for the most amount of people. That's what I try to do in this job. And we've been increasing the subsidies for Affordable Care Act, Obamacare. We've increased through Dr. Rambula's leadership and this committee as well, Dr. Wood, in the budget to cover people that aren't covered by that, people that are undocumented, and people still slip through the cracks. So I still believe that we should have universal health care at one time to focus on the efficiencies. I think too much money leaks out of the system, doesn't go to protecting people. But it leads us to the key question, which I think you're asking us, is the perfect versus the perfect versus the good. We don't want the perfect to be the enemy of the good. And that's what I think you're trying to do, because in reality, I don't necessarily see a path for the other bill. I don't see the votes for dramatically short. My name's there. I'll take the heat for it. My name there. I support it. I stand by it. But it's nowhere close. And so in the meantime, are we going to be purists or try to get more? And that's what I think that this bill is trying to do. And so I don't think they are mutually exclusive. And I want to have you, Senator Wiener, another chance to kind of walk through more, help us in maybe more in plain English, how these are not mutually exclusive and how these things potentially can be on two tracks, and what these waivers mean. Can one waiver be used for the other potential policy choice where you have to focus on the federal waiver?
Well, as the opposition, and thank you for that, as the opposition noted, if CalCare passes, then at that point, California will go to the federal government and make the waiver application. And CNA is, of course, the sponsor of the CalCare bill, and so and if that's how it happens, pass the bill, gets signed into law, present the waiver application, the work here to have those discussions with the federal government to figure out the scope and the structure of that waiver will be helpful. And so it dovetails. And I want to also just stress, this is a democracy, and people, who are sometimes parts of coalitions, sometimes coalitions have internal disagreements. The folks here on both sides of this bill have historically worked very, very closely together on expanding healthcare access and moving towards truly universal healthcare. And there's been this disagreement now, and I hope in the future that rift heals. But we all want the same result. We want everyone to have truly global, universal access to healthcare without having this fragmentation and having the unification. And so that's how I see it. And so that's why I think the bills are complementary.
Yeah, I concur. And it is, I think it's a point you make. This is a middle approach. there are some people who want more who are opposed. There's clearly people, we heard opposition, don't want any of these policies. Don't want CalCare, don't want this. But I don't know by doing nothing we're going to make any more progress than we're currently at. So, sometimes we have to make tough choices. This isn't voting down, what they're about. It's doing something now to move California forward and expand healthcare for our residents. So I know there's been a motion second. I support you, Bill. Thank you, Senator Neal.
Thank you.
Anyone else? Mr. Rodriguez?
Yeah, I want to thank Senator for bringing this forward. Obviously, we've been discussing this for the last couple of years now, right? So just want to talk a little bit regarding the waivers. Kind of looking through the language of your bill as well, but maybe as we look for the waivers, do you think we'll be confident we'll get the waivers for one?
So the CalCare has, as any difficult bill that is transformational, sometimes you have a long journey. And so obviously the journey through this legislature is not an easy one. We've seen that in the past. Although single payer did pass the legislature a number of years ago and was vetoed, so it's possible. But that's a tough road through the legislature that is, I think, doable. And then working with the federal government. And so these are all challenging processes that are going to take a lot of work and focus. And can I guarantee a waiver will be granted? No, I don't think anyone can guarantee that. We don't know who. It depends on who the administration is. It depends on if an act of Congress is required. Obviously, that's its own situation. And so that's why the work we're doing with this bill, I think, will be helpful in figuring out what the options are and what the most effective, most likely to succeed structure is.
Then with that, you spoke regarding the process at the federal level. Obviously, would also look at if we have a different administration, a Republican administration, how would that look for one? And for two, if we were to get a different administration, could that new administration pull the waivers back?
Well, it depends.
Once they've been given, right?
Right. It depends, because again, if an act of Congress is required for part of the waiver, obviously an administration cannot revoke that without a subsequent act of Congress. So if an act of Congress is required, that is clearly more cemented into law. In terms of administratively, yes, different administrations, and this is something that happens, different administrations can take different positions, but that's true today. There are healthcare waivers that are granted by the federal government today that can be revoked by a subsequent administration. So I think clearly as we go through this process, if CalCare is able to move through the legislature, we're going to have to be very mindful about how we structure things to try to protect California, because and I'm very confident that our administration and advocates are going to be extremely careful and methodical about making sure that we're protecting Californians.
Yeah, and then the last one is obviously the cost, right? 'Cause somebody has to pay for this no matter what, right? And when we have obviously the bad budget years like we're experiencing now, how that we take that into effect, right? That there is funding no matter what, right? Because it has to get paid for one way or another. So it's something that one of the biggest issues for me as well is the cost, especially when our state is in a position like we are now with money is tight and we look to cut positions and cut things. How does all of this? It's a very complicated issue, right? There's a lot of moving parts. We can't just say it's here because we got to see how everything else falls into place. So that was just another concern I had regarding the cost and how that.
Yeah, and I mean the good thing is, and what makes me proud to be part of this legislature, we're in a bad budget year this year, and we are really protecting access to healthcare. We're shoring up our hospitals. We're actually improving payments for Medi-Cal, which is long overdue, and we're doing that in a bad budget year because California is so committed to healthcare, and we've also stabilized our finances dramatically since the Great Recession, which was a disaster. But that is, and I think if you look at what we're talking about with single payer, unified financing, there are enormous opportunities to make costs more efficient. The current system is not an efficient system in terms of cost. It's the opposite.
Okay, thank you.
Anyone else? Seeing no one, it's up to me. We've had a testimony already, so thank you. I want to thank you, Senator Wiener, for introducing the bill today. Dr. Arambula and I are veterans of this discussion. Were it not for the work we did, there wouldn't have been a Healthy for California for All Commission. It was our idea, and Governor Brown actually took it, put it in the budget, and made it a reality. And it was started by Governor Newsom. So we're well familiar with the Healthy California for All Commission. And then, so I'm very familiar with the work. I sat on the commission and the recommendations of the commission on how we go forward to establish a framework for a unified healthcare financing system. That was how I understood it. Now others may disagree, but that is how I understood it. The formal process and the timeline that your bill establishes creates a clear pathway to achieve unified financing. That's, I believe, what you're after, from my interpretation. It's also consistent with the Commission's recommendation to develop a full proposal on unified financing. And the June 1 deadline to report to the legislature on elements necessary for a formal waiver application is critical for the administration to meet its obligations to accomplish and deliver unified healthcare financing for all Californians. So I plan to support your bill today. With that, would you like to close?
I think we've had a great discussion, and I respectfully ask for an aye vote.
Thank you. We have a motion by Ms. Berner, a second by Ms. Aguiar-Curry. The motion is due pass to appropriations. Madam Secretary, please call the roll.
Wood?
Aye.
Wood, aye. Waldron? Waldron, no. Aguiar-Curry? Aguiar-Curry, aye. Arambula? Arambula, aye. Berner? Berner, aye. Wendy Carrillo? Flora? Vince Vaughn? Mainshine? McCarty? McCarty, aye. Joe Patterson? Rodriguez? Rodriguez, aye. Santiago? Villapudua? Villapudua, aye. Weber? Weber, aye.
Your bill has 8 votes. It's out of committee. We'll leave the roll open for others to add on.
Thank you very much, colleagues. And thank you for all the bills today. Appreciate it.
We, while we're waiting for I know Senator Eggman is going to come up next, and maybe I'll have Madam Secretary, please call the, do you have a motion on the consent calendar? A chorus of movement there. So Ms. Aguiar-Curry, Mr. McCarty, we'll give them credit this time. Motion for the consent calendar, which is item number 9, SB 45, Roth with amendments. And item number 10, SB 344, Senator Rubio. Madam Secretary, please call the roll on the consent calendar.
Wood?
Aye.
Wood, aye. Waldron? Waldron, aye. Aguiar-Curry? Aguiar-Curry,